Hi, I'm Dr. Chang from Regis Medical. Today, I will give you a brief introduction to diabetes in the context of Singapore. Diabetes is a chronic health condition where the body is unable to produce sufficient insulin or is ineffective in using the insulin produced. Insulin is a hormone that is created by your pancreas that controls the amount of glucose in your bloodstream. Its main function is to regulate the sugar in your bloodstream. High blood sugar levels as a result of diabetes, if left untreated, can lead to many serious health complications such as nerve damage, heart disease, loss of vision, and kidney disease. There are more than 400,000 Singaporeans living with diabetes currently. This number could potentially go up to 1 million by 2050. Being overweight and unhealthy diets are the main contributing factors to diabetes in Singapore. Due to the culture and lifestyle in Singapore, many Singaporeans spend a lot of time seated down. This sedentary lifestyle, together with a lack of exercise, can lead to obesity, which brings about many health risks and possible complications, including diabetes. Diet is another contributing factor, which is getting higher in sugar content. We tend to consume a lot of refined carbohydrates that can increase blood sugar levels if taken in excess. In recent years, Singaporeans are obsessed with bubble tea. Today, there are more than 60 bubble tea brands in Singapore with a market value of more than $500 million, which is very concerning considering our small population. There are three types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is when your body's immune system destroys the cells that produce insulin, resulting in a lack of insulin in your body. Type 1 diabetes tends to develop in the early stages of life. The first noticeable period being 4 to 7 years old, and the second being 10 to 14 years old. It is unfortunately a chronic condition with no cure at the moment and requires lifetime insulin. Only about 5% of the total diabetic patients in Singapore have type 1 diabetes. Type 2 diabetes is when your body does not produce enough insulin or your cells are not reacting well to insulin. It is mainly developed as a result of one's lifestyle habits and is most common in adults aged above 45. Type 2 diabetes is often the result of an unhealthy diet and lack of exercise, which cause blood sugar levels to remain high over long periods of time. The pancreas has to overcompensate to create more insulin to regulate blood sugar levels. This eventually damages the cells within the pancreas, affecting its ability to create insulin. Prediabetes, on the other hand, is referred to as the stage before developing stage 2 diabetes. During prediabetes, blood sugar levels are high, but not high enough to diagnose the patient as diabetic. About 14% of Singaporeans between the age of 18 to 69 years old has prediabetes. Fortunately, prediabetes can be reversed if managed properly alongside lifestyle changes. It is important to spot early signs and symptoms of diabetes. These include feeling exhausted all the time, increased levels of thirst, feeling hungry all the time, blurred vision, numbness or tingling in the limbs, frequent urination, otherwise known as polyuria, loss of weight without trying, and frequent infections. Early treatment of diabetes can help to prevent serious health complications. In the case of prediabetes, early discovery can even help to reverse the condition. There are 4 stages of diabetes, as stated in a recent position statement, otherwise also known as dysglycemia-based chronic disease. During stage 1, the body starts to develop insulin resistance, making it progressively harder for glucose to be brought from bloodstream into the cells. In stage 2, which is the pre-diabetes stage, the insulin resistance of the body has gotten severe enough to the point where the additional insulin produced by the pancreas is insufficient to control blood sugar levels in the patient. In stage 3, blood sugar levels have reached a point where the patient will be diagnosed as diabetic. Type 2 diabetes has fully developed, with abnormally high blood sugar levels posing a risk of damaging other parts of the body such as the nerves and organs, leading to serious health complications. And lastly, stage 4, which is end-stage diabetes. Patients at this stage of the development of diabetes often experience damage to their vascular systems as a result of their high blood sugar levels. Various complications such as chronic kidney disease, heart failure, peripheral neuropathy, and stroke are common in diabetic patients in this stage of the disease. You may be at increased risk of developing diabetes if you have a parent or relative who has diabetes, you're age 40 and above, you spend a lot of time seated and do not exercise often, or if you have a diet that is high in sugar and carbohydrates. Diabetes can lead to many serious health complications if it is left untreated. These include heart disease, kidney disease, nerve damage, loss of vision, foot damage, loss of hearing, and skin conditions. All types of diabetes are diagnosed with either a HbA1c test, a random blood sugar test, combined with a fasting blood sugar test, depending on your clinical presentation and family history. Type 2 diabetes can be prevented by practicing healthy lifestyle habits and sticking to a healthy diet. Consult our doctors at any Regis Medical clinic to assess your risk of type 2 diabetes. From there, our doctors will suggest suitable screening tests for you if required, as well as lifestyle changes that you can make to lower the risk of type 2 diabetes or to keep your condition under control. At Regis Medical, we seek to understand the patient as a whole, and we view this condition with holistic and humanistic principles. For more information on diabetes, you can visit regismedical.com. We wish you and your family good health.